Before we break for lunch, I'm going to give some instructions for lunch, but before we do that, I wanted to invite up Dr. Dorothy Fink, who is the Deputy Assistant Secretary for Women's Health and the Director of the Office on Women's Health in the Office of the Assistant Secretary of Health at the Department of Health and Human Services. It's a mouthful. To give a few remarks, and then we will give some quick instructions for lunch and give everybody a break.
Well, hello, everyone. It's such a pleasure to see all of you here today, and I thank you, Dr. James and her entire team, for bringing us together. On behalf of the Assistant Secretary for Health and the HHS Office on Women's Health, I'm thrilled to be part of this conversation with all of you today, and it's been such a pleasure to meet many of you that we've had phone conversations with, and new people today as well. The Office on Women's Health provides national leadership and coordination to improve the health of women and girls through policy, education, and model programs. Our office leads the Coordinating Committee on Women's Health through Health and Human Services and really serves as a focal point to bring activities together across Health and Human Services and really improve the health of all women through interagency collaboration. And, as we've heard today, we really need to think about bringing all of us together from across all of the incredible agencies within HHS, and then bring in all of these incredible stakeholders to think about how we can solve the crisis of maternal mortality. Currently, my office is leading a review of all of the current and past programs throughout HHS with the CCWH to really understand what we've accomplished in maternal mortality and where we can go from there. The Office of Women's Health has incredible programs looking at maternal health and opioids, as well as postpartum depression, as well as the state-level paid family leave policy project. And so we really want to think about all aspects of women's health as we look at this crisis. What I love about Emerald Giroir is that he's always challenging us to really think about prevention. And so within OASH, we're looking at, even within the Office of Minority Health and Captain Collins, we're teaming up to say, how can we think about women's health not just at delivery, but much earlier on? So we have incredible programs, including the Youth Engagement in Sports Initiative, where we want to start working and looking at adolescent health, because if we don't have healthy girls, we don't have healthy women, and we don't have healthy pregnancies. This morning, we've had the opportunity to hear from so many incredible stakeholders regarding the current state of maternal health in rural America. Dr. Wanda Barfield and I have had some conversations on the phone, and I was thrilled to hear her present in person. And I will say that something that really struck me from her remarks are, we were here today to talk about maternal mortality, but infant mortality is inextricably tied. And if we can't solve the problem of preterm birth, then we have all of this infant mortality, and it just becomes this vicious circle. And if the mom's not healthy, the infant isn't healthy, and if the infant isn't healthy, that can lead to all sorts of problems for the mom too, and challenges. And so I really think that the maternal-child dyad is something that we need to think about, because they're not separate silos. And just as in government, we don't want to be silos and we want to all work together, we need to think about that as we look at maternal and child health. I've been struck by so many remarks, and I don't want to hold us from lunch, but I'll just say one other thing that has struck me is, thinking about pregnancy as a stress test, for all women in every single county in the USA. And in my experience in pre-federal life, I can't tell you the number of women that I cared for who had gestational diabetes or, all sorts of complications around their reproductive health years, and how those came back later on in life to impact them, or how it impacted them in another pregnancy. And so often we're so focused on, okay, baby's delivered, the diabetes just went away, go on with your life. And so many women don't realize the impacts of how the stress test does help us learn so much about what we need to be thinking about for our health. And so I really challenge us all to think about that across all social determinants of health, and how we can really impact that to help women understand the impact of how pregnancy truly is a stress test, and how we have to think about these steps so much earlier on, because if we have women entering pregnancy and they're already overweight, that only leads to more and more complications with every pregnancy. And so we are looking forward to hearing from all of you at lunch to share your thoughts about what we need to do in order to improve access to care and health outcomes for women living in rural communities. Let's think about public health, policy, workforce, quality improvement, health disparities, and social determinants of health across the continuum of pregnancy. I want to thank Dr. James and her team for organizing today's meeting, and thank all of you. And we really look forward to hearing from you, not only today, but beyond, to really coordinate care for all women. Thank you.